Hello everyone, I am Dr. Arup Badra. I'm the Director of the Joint Replacement Program at Good Samaritan Hospital here in Suffern, New York. I'm here to welcome all the patients in the brand new unit, which we have a 10,000 square feet premier unit for individual patients' room, 14 rooms for each patient they get after the joint replacement surgery. We have got a multidisciplinary team consisting of very experienced physical therapist, nursing staff, anesthesiologist and pain management, and also the medical management by the hospitalist and the internist during their hospital stay. We do have a physical therapist and an unit on site on the floor which providing physical therapy for better and quicker recovery, practicing them for their daily life activities, including getting in and out of the car, using the stairs. And most of the patients, they're able to walk on the same day of surgery, and they can quickly leave the hospital, be on their feet, and be back to their home and the family, and back to their community. We provide different levels of services, including the traditional as well as the robotic assisted joint replacement surgery. Our experienced surgeons provide partial knee replacement, total knee replacement, as well as shoulder replacement and hip replacement. Robotic surgery, it works towards precision and also quicker recovery because of minimal soft tissue invasion, and we have been doing it for the last 4 years. We have performed over several hundreds of joint replacement surgery, and patients are very pleased with their outcomes. Pain management is a very important part of joint replacement surgery, particularly after surgery. We work very closely with the anesthesia team and pain management team. Preoperatively, they practice mindfulness, which has been in recent time very, very helpful for the patient to get through their pain and be more mobile immediately after the surgery. We also have got a dedicated joint coordinator who is going to take care of all of you, starting from the decision making at the surgeon's office, followed by just during and after the surgery, during your recovery process. She is going to be with you all the time. So we are very proud that our joint replacement program has been awarded with double certification gold standard by the Joint Commission. You have to perform certain or follow certain protocols and guidelines, and also your outcome has to be really the best standard outcome possible in order to get certified by the Joint Commission, and we have achieved that 2 years in a row. We'd like to take this opportunity to thank you all and welcome you to have your procedure performed at our local joint replacement center at Good Samaritan Hospital, and we can put you back to your feet and back in the community with our rapid recovery program. So I'd like to see you all, and thank you again.